Hola, buenas noches.
Buenas noches, profe, ¿cómo estás?
Estoy bien, ¿cómo estás?
Excelente, profe, muchas gracias. ¿Y tú?
How is everything going? Too busy? Or everything's okay with everybody? ¿Escuchan bien?
Hello, yes.
Hello, okay. Um, I'm gonna wait like 3 more minutes to see if more people come in, and then we can start. Does anybody has any questions from last class? No? Okay.
Good night.
All right. I could grade today one of your activities. I'm very proud of you. Most of the groups, most of the students got very great marks in there. Some groups just need to adjust some details, very minimal details. Overall, everybody did a very great job. I'm very proud of you. The other activity, I think activity 5, I'll try to grade that this week or next, maximum Wednesday next week. Okay, and then you're gonna see your grades. Other than that, everything looks good. Grab my class here. Does anybody remember where did we stop last week? I don't remember
We
if
just
we
finished obesity. We are
obesity.
just
All right.
we are going to start
Arthritis.
uh-huh.
Good. Thank you. I was like, I don't remember if I explain arthritis or if I have to start on cancer. So arthritis will be first. Okay. Can you see my screen? Yeah. Is it visible?
Yes.
Okay. So let's talk about arthritis, and that the same thing applies to any type of joint problems. So usually the arthritis, they are caused by obesity, high weight in the animal. So one of the things that we do with the treatment of arthritis or any type of joint problems or hips problems is the weight loss, right? Because we need to work on those inflammation, and we cannot lead all that excess of weight to compromise more the joints and the hips. Okay, so the first thing is work with the parents with a plan, a good plan for losing weight, and also implement some supplements in this diet to help with the inflammation, help with the chondroitin, glucosamine, and other things that might help with the pain and with the problems. Okay. Um, so some of the nutrients that we can use, they are here. So I really like to use, it's not here actually, the bone broth. The bone broth is very, very rich in glucosamine and chondroitin, and it's high bioavailable for them, which is quickly absorbed by the organism and quickly um, used in the tissues and everything. Other things that are very good to work with is the avocado saponificables because they are anti-inflammatory, antioxidant, and it helps to build the tissue again. Um, One thing that you can do, I don't know if in Colombia it is very common or not. The how can I say that in English? The polvo de astra. I don't know the name in English. It's missing of these animals here. Here we can find that as a treat for the animal to chew on, and sometimes it comes in, it breaks down in very, very tiny pieces that look like just dust. It looks like dust. It doesn't harm the animal or anything. And it is very, very rich in chondroitin. So it's very good if you have access to it. In here in Canada, people go hunting so much. So this is something that is very cheap for us to find. Um, so this one, as I said, I prefer the bone broth, but if you cannot have the bone broth, you can use normal supplements that I know that it's very easy to find. Juliana, do you have a question?
Yes, I have a question. Maybe, sorry. Uh, maybe about the bone broth, how much we can give it, or it count like a protein, like something else, or
It counts as a supplement. Okay, so usually for big dogs, depending on the level actually of the disease, but for this situation, I usually recommend 4 to 6 tablespoon for big dogs, 2 to 4 for mid-sized dogs, and 1 to 2 spoons for small dogs every day. It helps a lot.
thank you.
No problem. Okay. So this is another supplement that I like to use for this kind of, sorry, I'm a little bit cold. Um, that I like to use for the situation. Okay, of course, as this has a lot of chondroitin, instead of using like lots of things that has chondroitin or glucosamine, we are going to pick one of them. This is expensive, so if you have access to it, that is one of the best things. But as you don't have access most of the times, like here it's very expensive. I usually go to the bone broth, omega-3 spirulina, and the this one here. Okay. And talking about spirulina, spirulina is high antioxidant, high anti-inflammatory, and also depending on the medication the animal is taking with the diet. Maybe the medication is very strong that can affect the liver, that can affect the kidneys. So if it's affecting oh my God, the liver, the spirulina is very helpful to take the toxins from the liver and get it out of the body. Omega 3 It's always good to have food rich in vitamin C, vitamin E, and carotenoids like carrots. It's very good. And if you want to combine more supplements, natural supplements like curcum, extract the green tea, but no caffeine, Ortiga, Yucca, Brucellia, this one, and bone broth. They are great ones to include in the diet. Usually, what I do is I make some tea from some of them, and I alternate the teas every day because they get a little bit picky when it comes to this kind of supplements because it doesn't taste very good. So making this rotation will increase the acceptance of the animal. Any questions about arthritis or any other type of joint or ligaments problems? The base of the diet is the same, okay? You're using a raw diet or a cookie diet. If you're using a cookie diet, low in carbs, because the carbohydrates, depending on the level of glucoses, it will help with the inflammation. So in this case, if you're using a cookie diet, a low carb cookie diet, but the base is the same, we're just adding these supplements to help with the treatment that the veterinarian will give to the patient. Adriana?
Hi. What other source or ingredient can you recommend it? Because here no take polvo de asta de ciervo.
Sorry, can you repeat that?
What other ingredient
Mhm.
do you recommend? Because here in Colombia no take polvo de asta de ciervo,
Oh, okay.
the replacement.
Mhm. So, you mean the base of the diet, or do you mean the supplements here?
I think she meant the other supplements.
Okay. So if you don't have access to this, that's okay. You can have another source of chondroitin. So for example, you can make a bone broth. Bone broth is very easy to make. There are some brands that they already sell the bone broth dehydrated. You just need to add water and you can make the broth again. And they also have high levels of chondroitin, so you don't necessarily need to use all of them. Okay, so all of the sources of chondroitin, you're gonna pick one of them. You don't need to use all of them. Okay, so if this is not accessible for you, you can make a bone broth.
Thank you.
No problem. Any other questions?
Yes, I have one.
Yes.
I have a question about um, maybe some other topic, but we'll just pass the obesity. Maybe um, I want to change the diet of our dog to concentrate to keep to natural, but also I want to lose weight or control the obesity. It's possible, and I know the transition it's often like 3 4 days, but maybe it's a picky dog, so transition is a lot longer. And maybe if it's some kind of advice that you can give it to me for making the transition and making lose weight.
Okay. So during the transition, I wouldn't worry about losing weight. I would worry about calculating everything for losing weight after the transition is done. But usually, when they go from keto to natural diet, independently if this natural diet is light or if it's normal level of calorie, naturally the animal will lose weight, or it looks like they're going to lose weight because as they will ingest more water, all that excess of water and excess of minerals that looks like they are um, looks like they are sleeping in the water actually, like they will drain all that water naturally when they pass to the natural diet. So during the transition you're going to see that they will pee more often, that they will drink more water as well at the same time, so they will start to disintoxicate from the kibble on this transition week. And when the transition finishes, then I would adjust the calories and everything for him to keep losing weight. I don't know if that helps.
Yeah,
Yep.
thank
Okay. Any other questions? Okay. So my next disease is cancer. And cancer are usually associated to obesity as well. Like most of the diseases, they are associated to obesity. So if that's the case, yes, the first thing to do is adjust the weight of the animal. Also, the height of glycemia in the diet. So, food with a high rate of sugar, carbohydrates, they contribute for development and spread of cancer cells. Why that? Because the cancer cells, they first of all, they can have the animal can have genetic predisposition to it, or toxins in the environment, plus obesity, plus other factors that can lead to the high predisposition to cancer cells. If they have any type of cancer cells in their body, and we keep feeding the animal with carbohydrates, sugar, that's what the cancer cell eats. Okay, so cutting down the carbohydrates in the diet, which is the keto diet, we are starving the cancer cells and they will start shrink, and they, with the treatment, they will regret and disappear. Okay, so these are some of the factors that are linked with cancer in both dogs and cats. So in this type of diet, we don't do a regular based diet as we were doing for the other diseases. The cancer diet, the keto diet, they are mainly done by fat and protein. Okay, just a little bit of vegetables, just to have the minimal amount of fiber that this animal needs, but most of the diet is made by fat and protein. Okay, as the level of fat is high, very, very high compared to a normal diet, and of course, the organs of the animal especially the pancreas, is not gonna hold it well, this diet needs to be done in phases. The most common is 3 phases, but if the animal is more sensitive, we can do in more phases, like 5 to 7 phases. Where in these phases, we are going to gradually increasing the level of fat and the level of protein and decrease the level of the other nutrients. Okay, I'm gonna show you an example, but usually this is a raw diet. If another organ was compromised by the cancer, especially the liver, we can make it cooked, but carbohydrates doesn't go in this type of diet, even if it's cooked. Okay, so no carbs at all. Let me show you an example. That's my own dog's diet, actually. Okay. So usually for keto diet, normally when we go to phase 3 or phase 5 or phase 7, depending on the dog, most dogs go through 3 phases. The final diet might have 55 to 70% of fat, 30 to 45% of protein, and the rest is fiber, carbohydrates that are naturally in the other ingredients. We try to select the ingredient that is the maximum that we can lower in carbohydrates. We just leave the a little bit of vegetables just as a source of fiber, so the intestine can work a little. Okay, so here is one example of phase 1 of this diet. So as Lisa was already on BARF, halfway through we got there. Okay, usually this first phase is longer. In this one we did in 2 months, but usually it's done in 3, 4, 5 months, because especially if the dog or the cat they are eating kibble, from kibble to this is a lot of change in the organism. So if the dog doesn't eat natural food yet, we need to first of all go to barf, okay? And after the barf for a month or two, then we go for the first phase. As she was on barf already, in 2 months we could complete the first phase for her pancreas and her liver to get used to the level of fat in this diet. Okay, so Lisa is a Malamute, and usually on barf she eats 1 kilo-ish of food. Okay, in this diet, in the phase 1, you can see here it's 700 grams. Okay, it looks a lot less than 1 kilo, but it's because as it has a lot of fat, fat has high calories. So we are balancing the calories. So you're going to see that the diet looks very small in amount because of the level of fat, because fat has 4 times calories than proteins. Okay, so as a suggestion, we had 350 grams of meat bones. We had 230 grams of meat. Here's the suggestions. 40 grams of organs and 80 grams of vegetables. And here's the supplements that we were doing to increase the level of fat and also to help with the shrinking of the cancer cells. So here we are using the brain octane, but we can substitute, if that's difficult to find, to coconut oil, um, olive oil, avocado, and cheese. Okay, so these are the fat supplement for her, and other things to help with the cancer. So herbs, dark green herbs, like this one. Probiotic, prebiotic, supplement of silimarine, omega-3, and chlorella. Okay, so these are the things that helps the organism to detoxify and help with the fight cancer process. After 2 months, we went to phase 2. Okay, so phase 2 lasts 2 more months. And just take a look here, 100 grams less than phase 1. Okay, because we increased the fat and we are decreasing the other ingredients. So instead of 350 grams of meat bones, now we have 300. Instead of, I don't remember, 230, now we have 200 of meat, and then 50 grams of organs, 50 grams of vegetables. Here we included 1 spoon of shea, hydrated in the bone broth. Here we increase 2 spoons of the brain octane, or it can be the coconut oil. The olive oil remained the same. 2 spoons increased of avocado, and these remain the same. Here it remained the same as well. So yeah. So after 2 months, we went to phase 3. And one more time, we decreased the amount of the food because we are increasing even more the level of fat in this diet. So here we reached 70% of fat of this diet, and we had 300 grams of meat bones, which is the same as phase 2, but we decreased the meat. Here's the same, here's the same, she is the same. So here what changed, we increase 1 more spoon of the brain octane and 1 more spoon of avocado. We added egg and everything. Here we just added this krill oil as a source of omega-3 because she was shedding too much. So it was helping with the shedding. And she added with the chlorella another alga, which is spirulina. So that helps to protect the liver. And she was in this diet for 2 more months. She did another blood test and other exams, and she was cancer free. And then we can slowly move back to phase 2, and then phase 1, and then BARF, and she's on BARF since that. Okay, so it was all this process, a year-ish on keto diet, and then she came back to BARF, and now she's on BARF cancer-free still. She does her blood work and all the exams every 6 months, and thank God she's fine. She's very good. So yes. One more note, she didn't do any chemotherapy or anything, just the surgery to remove the tumor. Right after surgery, she started the keto diet, and she remained cancer-free since that. But the cancer didn't spread, which was easy for us to work on this. Usually when the cancer spreads to other organs, combined to the keto diet, we need to do other treatments like chemotherapy and other treatments that the veterinarian might do to help the dog with the cancer. Okay, in this case, it was not necessary, but most of the case it is. Any questions about keto diet? Yes, Maria Fernanda.
Are these diets supposed to be administered to them only while they have cancer, right? Like once they're healthy again, they can go back to the regular
Yes,
diet.
exactly. Mm-hmm.
Okay. And is there like maybe like I don't know if it we have like a dog that like he has had cancer for a long time. Is there like a specific time for this diet to be administered? Like, for example, you can only feed this to them for up to 5 months, 6 months, or there's no restriction.
It depends on how the animal handles it. Okay, for example, my dog had no problem with this diet because she's always starving. It looks like she wants to eat everything all the time. So the level of fat didn't affect her. But I have some clients where just a little bit of increasing of fat made them sick, made them throw up, made them to refuse the food. So if that's the case, we need to be a little bit more careful and we need to increase the level of fat a little bit more gradual. And if there is a point where the animal is refusing to it because it doesn't taste good, then we don't reach the 70% of fat of this diet. Maybe we reach 50, 55, or even less than that because of the acceptance. But there is no um, contraindication that, okay, this animal can only be in this diet for 1 year. No, as long as they need it, they can do. I know some dogs from another veterinarian that is the nutritionist that helped me with Lisa's diet, actually, that she has patients where they are in cancer treatment for 5 years and they are on keto diet for 5 years with no issue. Okay. And she has also patients where they are already cancer free, but they remain in the keto diet because the chances of the cancer to come back is high. So, as a way to prevent the cancer to come back, they remain in the keto diet.
Okay, thank you. Do you maybe like recommend the proportions for each ingredient, like with the other diets that we've seen, like for example, 60% meaty
Mhm.
bones, and what are they?
Okay, so as we need the protein to be 30 to 45%, we can use from these 30 to 45%, we can use, for example, 25 for meat bones and 20 for meat. It depends on the acceptance of the dog, actually. But here in Lisa's, is it? Here in Lisa's, the I'm gonna get the third one. The third one, we used, she used 5% of organs only. And I can do calculations by head, but she used from these, I'm sorry. Yeah, because this is not the total per day because she put it this. But yeah, but 30 to 45% will be protein, so you can manage here the meat bones and the meat. We can manage according to what the dog will accept and the level of calcium too. So usually it's more meat bones than meat as the barf. Yeah, and usually the organs it decreases to 5%. A 5% of organs and 5% of vegetables.
Thank you so much.
No problem. Okay. So things that can help, and we can add in the ingredients to help the animal to fight the cancer. So curcum, um, we sometimes we find the gold paste. The gold paste is just a mix of coconut oil with curcum and other ingredients to make the gold paste that can be a great supplement. Um, Food that are rich in folate. So usually we find them in dark green vegetables. So when we are selecting the vegetables for source of fiber, we also select the vegetables that are rich in folate and also the cruciferous like cauliflower, broccoli, because the isotiocinatos, they are also phytochemics that has a effect that is anti-cancer. So usually we combine them to these 5% of vegetables that the animal is eating. Just to add, the cruciferous, as it has a high level of oxalate, we usually use that maximum 3 times a week. And also food that is rich in vitamin B12 because it has helped with cancer as well. So usually when we are selecting the proteins, give the preference to this type of proteins because it's high in vitamin B12. Okay, other ingredients. So usually we selected these two as part of our ingredients, especially if you want to vary the ingredients that we are selecting. So these are others that we can use for keto diet. Okay. Omega-3 is a must-have. Herbs as well. Echinacea is one of the ones that we use a lot because it helps to disintoxicate the body. Probiotics, spirulina, vitamin D. So they are all nutrients that help fighting the cancer. Any questions about cancer, Andres?
Yes, teacher, how are you?
Good, how are you?
Fine, thank you. So, I have a question about one specific supplement, about the CBD. I know it's not like an essential nutrient. I know it's more like, I don't know if it's a snob, or you recommend us to use it as not only as a help in the treatment, but nutritionally you have seen some research, or maybe you have seen something that could be for help, like the supplementation, not just because there's no.
I love CBD oil. For cancer, yes, I highly recommend because it helps a lot shrinking the cancer cells and preventing new cancer cells to appear. Also, I highly recommend for animals with behavioral issues, separation anxiety, and reactivity, especially. It helps a lot. And other diseases like epilepsy and anything related to the brain, the CBD oil, it helps so much. There is one veterinarian in Brazil that she is a specialist in cancer and neurological diseases, and she's also a nutritionist. Lots of the materials that I put in the platform for you, it's from her. Her name is Jacqueline Mota. She did a really great research in the past years here in United States, evaluating the effects of the CDB oil in the nutrition of dogs and cats and how that affected the treatment for lots of diseases. So, if you want to find her articles, her name is Jacqueline Mota. It's very great work that she does and shows lots of good results. I have like a proof in my house. For example, Lisa, which is the diet that I was showing to you, she's also a reactive dog, and since she started with the CDB oil, it helped so much. It helped like magic. It is really great. Okay.
Thank you, teacher. And another question. Do you recommend any dose because you can see there's a lot of information of doses, or you just try patient a dose for any kind of patient? I mean, for your dog, 20 kilos, you start with X or any kind of grams per kilo. How do you start with the dosification? Because here in Venezuela, I can have uh, it's not legal. So we have like a bunch of concentrations, and it may be sometimes it's very difficult to try to get
It
the
actually depends on the
human. Okay,
Yeah, it depends on the concentration. Usually, I don't know how it works in Colombia, but here in Canada, as it is legalized, we can make it, we can order the manipulation. So usually for Lisa and for my other patients, I usually recommend a high amount of CDB, very low in T8S, because the T8S in a certain level it is toxic. So it doesn't need to be zero, but it needs to be low. The proportion of T8C and CDB is 1 to 20, 1 THC to 20 CDB. And for my dog, for example, she's 38 or 9 kilos. She gets 2 drops per day only. It's very minimal. A dog that would be a mid-sized dog, I would say 1 drop maximum or 1 drop every other day. So one day I do it, the next day I don't do it. And for small dogs, I would do twice a week or 3 times a week maximum. I don't know if that helps. Yeah. All right. Any other questions? No? All right. So the next disease is problem behaviors. Usually have that a lot with dogs. We Usually don't have too much with cats. The incidence in dogs is much higher than cats. So this is something that sometimes some veterinarian just miss it, because the dog's old, it's getting to the end of their life and they don't worry too much about it. They process this as something natural, but we can help them a lot in the stage of getting old, to help the brain to still function well. And the food is one of the ways that we can help them. Okay. So when the animal has any type of cognitive dysfunction, independently if it's caused by the age or caused by another neurological disease or neurological problem, or even a problem behavior like a high anxiety level, a high reactivity level, so usually working on a diet that supports the brain can help a lot. Okay, so usually the behavioral symptoms that we have most of the times are anxiety, reactivity, and separation anxiety. Um, Rumination, also marking territory a lot. It's another thing that happens a lot. Um, it can be caused by hypothyroidism. Okay, sometimes we think the dog's aging or we think the dog has a behavioral problem, but if we do a blood work, we can detect the hypothyroidism. Okay, it sometimes can be confused. Only the vet tests can give me 100% of sure that the dog has this condition here and not, oh, my dog started to be aggressive out of nowhere, my dog started to be anxious out of nowhere, nothing happens. Oh, let's make a test. Oh, hyperthyroidism. Now that makes sense. I have lots of cases in Brazil, especially, where dogs were attacking out of nowhere. Dogs were killing other dogs that never did anything before, or dogs in the same house that never had issue, and then because of hypothyroidism, they have those major behavioral problems that sometimes we can detect, sometimes something happens before we detect it. Okay. Um, so carbohydrates, one more time. The food with high level of glycemic, they will sabotage the health of the brain, will give the animal a peak of hyperactivity and very low concentration. And then when the peak starts to drop, they will be very lethargic, very irritated, and very reactive. Okay, so this diet here must be low carb. Um, Also, we are selecting ingredients that are high in tryptophan and tyrosine. Usually, when the animal eats economic kibble, like pedigree, dog chow, usually they have deficiency of them, and that's how they have these types of problem behavior. Also, we change to a premium or super premium diet, or even better, a natural diet, we can see a lot of difference in these problems behaviors. Yes, Adriana?
I have a question about if you need, for example, a, a dog has a high level, is hyper. very hyperactivity. This dog all time is think, very thin. The source of energy for take a correct body condition, maybe you need to use more fat with this dog.
Exactly.
Oh,
Instead of using carbohydrates, I would use more oils or more fat meat.
normally these dogs, this type of dogs take problems with absorb the nutrients. Normally has diarrhea or gases. This
Are
can be better with the fat.
Yes, because usually the diarrhea and the gas, they might be causing it the high level of carbohydrate.
Okay, interesting. Thank you.
No problem. Okay. All right. So tryptophan, it's present in all the type of proteins bioavailable that we are using in a natural diet. So we don't need to supplement with tryptophan because our diet is rich in this nutrient. And as it is the precursor of serotonin, it will control the appetite, it control the humor of the animal, and consequently control a little the behavior of this animal. So usually decreases the anxiety, decreases the reactivity. So low tryptophan is related to high of reactivity, depression, and high level of stress. So animals, dogs and cats, that they are very reactive. Also, we change to low carb and high bioavailable proteins. These behaviors start changing. Also, tyrosina is the precursor of dopamine, noradrenaline, and adrenaline. So we are combining the right proteins. We can balance this. Combining to a good quality protein, diet rich in antioxidants will help with the brain free radicals. So we usually include the berries, the omega-3, and other antioxidants as supplement to help this brain to calm down. Okay, so what are the types of supplements or the type of ingredients that we are selecting for these animals? So food rich in vitamin C and vitamin E, uh, ácido alpha lipoico and L-carnitine. We don't need to supplement them. We just need to find the food that is rich on them, and usually the meat already have that. Milk thistle is a herb that we can supplement. Coconut oil, omega-3, and the berries. Okay, so they are a must-have in this situation. Any questions about cognitive dysfunction? Juan?
Sure. I have a question. Uh, what are low glycemic index carbohydrates?
Sorry?
What are low glycemic index carbohydrates?
I didn't get it, sorry.
Juan, ¿le ayudo?
Sí, porfa, es que estoy mal de la
Estoy
voz,
preguntando
hermano.
cuáles son o qué son. ¿Cuál es la pregunta? Juan.
Sí, estoy muy mal de la voz, hombre.
No,
¿Cuáles
no,
son
no,
los
dale, dale.
cuáles son los
¿Mm?
carbohidratos de bajo índice glicémico? ¿Cuáles
Calma.
recomienda la profe?
Teacher,
Mhm.
which ones are the low glycemic index carbohydrates, and which ones do you recommend for
Uh,
the for
mhm.
use?
I recommend the dark green leaves, and all the vegetables that are high in fiber and low in carbohydrates. For example, I would not use the pumpkin because pumpkin has a lot of carbohydrate. When we are comparing the amount of fiber and carbohydrate in there.
Correct.
Um, I would use the cauliflower, green beans, bell pepper, bok choy, cucumber. Um, what else?
Okay, give me one
Yeah.
second because I will forget it. So,
Okay. Okay.
entonces, utilizaría principalmente los vegetales de hoja verde, ¿cierto? Que sean altos en fibra, que uno de los que no recomienda, dependiendo del caso, podría ser la calabaza, porque en relación a los que son tipo hoja, pues tiene mucho más carbohidratos. Entonces, utilizaría el bok choy, bueno, el pimentón, bueno, y otro que se me fueron un montón, el pepino, se me fueron un montón, pero bueno, ahí básicamente los verdes oscuros, the dark greens, ¿no? Sí, como lo
Listo,
que ella más recomienda ahí.
listo, Noel, muchas gracias, hermano.
Teacher, I have a question.
Mhm.
I would like to ask you know about the carbohydrates, not only, but also I want to ask you about the kelp, the dosage of the kelp. I am a little confused with the kelp because we need so much the iodine for the function of the that part of the body that produce T3 and T4, and we must need iodine. And when I want to make the supplement, I was thinking about kelp, but I don't know how much kelp. And the problem is that there are many kelps, and
Yes.
you, for example, you can find in one kelp 2,000 milligrams per 100 grams. In other, you can find 1,500 micrograms. I don't know. I don't know. I want to know if you could give about your experience. How much is the dosage
Mhm.
for dogs and cats? And I don't know if you can write in the chat because I need to have that percentage for
Mhm.
your time. Thank you,
Yeah.
teacher.
Okay. One thing, the cats, they, depending on the source of iodine that you're using, for example, if you are using the avocado, the cats might not take it. Okay, because cats has a very high difficulty to absorb nutrients from vegetable sources. But if you're using kelp, which is algae, but usually when we do the capsules, it's all breakdown, so it's enriched. The cats don't have a problem with that, so kelp is safe for cats to use. It is a source of iodine. Also, iodide salt, the salt that we use to put in our food that is enriched with iodine, the cats can take that too. Okay, dogs, anything. The amount of iodine to supply the needs for dogs and cats is so little, but so little that one pinch of iodine salt is enough for both dogs and cats. Okay, if it's a big dog, I would say 2 pinches of iodine because it's very little. So, for example, the kelp that you found that it has the least amount of iodine can be enough for a cat or a very small dog. Twice a week might be enough for them. Okay, if it's a medium-sized dog, I would say 3 to 4 times a week. If it's a big, a giant dog, once a week, every day. Okay, they don't need the high concentration of iodine in the kelp, so I would buy the low concentration because the amount is very minimal. Of course, it's not going to intoxicate them, but the minimum amount is enough. Okay, if it's easy for you to don't use the kelp and just use the salt, it's fine.
The salt,
Yes,
the salt can be used in both dog and cats.
dogs and cats. Yes.
Okay, and you took that for little dogs and cats. One you make a movement that I don't.
One peach.
Okay, one pitch.
Pitadinha.
Okay, pisca in
Pisca.
Colombia,
Uma pisca de sal.
and every day of salt,
Every day. Yeah.
and for big dogs too,
2
every day.
every day.
Thank you, teacher.
No problem. And one more curiosity, the black pepper, the one that we use in our food, a little pinch of black pepper increases the absorption of iodine. So if you want to use it, that's great too.
Okay, thank you. Fine, my last question about that. And in terms of grams for kelp, you told that for little, 1 to twice a week for little and
Yes.
cats.
Mm-hmm.
But how much in grams?
I need to find the answer for you because I can't remember that.
Okay.
But I'll find that. Let me make a note so I don't forget it.
I'll really appreciate if you can help me with that, because I would like to know how much kelp for little and for cats and for medium and for big dogs. Thank you.
No problem. Any other questions? Juan?
No, teacher.
Oh, it's from the Juliana. It's also from the other time.
Yeah.
What was the salt that you said that we could use?
Salt that is enriched with iodine. Most countries, the salt is enriched with iodine. So if that's contain iodine, you can use that salt.
Okay, thank you.
Teacher, one last question, but it is about the no, se me olvidó. About the software. So basically, would recommend us to pick, for example, any supplement that we can found around us, and basically putting in the software? That will be a recommendation you would get us, or do you only recommend to use the brand indications for the supplementation? I don't know if that makes sense.
It makes sense. It depends. There are some brands that I like to use because I know they are good. But as much as I can, I try to use natural supplements. I try to take that from food because it's cheaper and more bioavailable.
Thank you very much.
No problem. Only if the pet parent they want to facilitate things, like I don't want to kill myself, try to find this, and that, and put every day this, and that in my animal's food. I want something practical. Okay, here is a brand for you.
Teacher,
Yeah.
I really appreciate the to clarify me, because I have a fight with with another veterinary, because I told him, okay, you must use the iodine salt every day, and he told me, "What are you talking about? You can't use salt in dogs or cats. Are you crazy?" And he told me that I
Uh,
didn't know anything about nutrition because I was recommending iodine salts. For that was my question, because I
ask him
recommend
to read the label of all the kibble.
because I was recommending iodine salt every day, as you told me 3 minutes ago, and he told me you can't recommend salt for dogs and cats. But thank you.
Yeah, that's a myth. Like, I don't know why people think that every time someone comes to me, like, oh, sometimes I give food for my dogs, but no salt, no oil. And I'm like, why you are panicking? Like, you can give salt and you can give oils to them. So I don't know where this myth came from, but yes, they can have salt. If you read all the labels, you're gonna see there. It's in there. So I don't know, because it's rich in sodium and they take a little bit of salt will like make the sodium level to just peak high. But yeah, I don't know this myth, but most people they think they cannot have any kind of salt and herbs and spicy. I don't know.
And the fact is that the veterinarian that was fighting with me was nutritionist too, and he told me that he used the iodine salt once a week, and I told him it's every day. The salt you must supplement every day. This, the iodine salt, and he told me that the once a week was the maximum, and was better if I don't supplement with iodine salt. For that was very interesting. I mean,
It
I
depends on
hope
the amount he's using. If he's using like a lot of salt, yes, once a week makes sense, but just a one little pitch, it's not gonna harm the animal.
yeah.
I'm not asking to put like 1 spoon of salt. It's one really very tiny peach. Very, very tiny. Okay. All right. So let's move here. And this is a picture from the book that I love, that I think I showed you already. This is a must-have. I love this book. It has so much great information. Like, I have like lots of stickers here because I'm always, always, always looking at this book. Lots books as well, but this one is like my favorite. Um, so here is one picture that I really like because it's easy to when we talk about like diseases in animals and diet, we think like, oh, we need to have a formula for this and a formula for that. And this picture just summarizes everything. Okay, so independently what is the type of the disease, and that I can put much more in here, not only these four, but everything summarizes in a very good basal diet. Okay, diet that is rich in good protein, rich in 5 to 10% of great organs, and the right vegetables, low in carbohydrate. And every time that I have this basal diet that is very nutritious, which is all the things that we have talking about so far, I just need to add for each disease the supplements that are natural, that are easy to find to help and to support these animals. Okay, so here, for example, liver disease, I just add as much as I can these ones. Okay, they are easy to find, they are zero contraindications, and they are helpful for liver disease. Okay, kidney disease, same thing. I'm just, instead of adding everything, I'm not adding the milk thistle and the SAMe. Bowel disease, same thing. Skin problems, same thing. Okay, so these are sources of natural supplements, and most of them, and more than these ones, you have a very great list on the platform that you always can use as a resource for you. Okay, so now I'm going to talk about kidney disease. When we have kidney disease, the first thing that comes to everybody's mind is lower the protein. Low the protein, you have to low the protein. The animal cannot take high protein because of the kidney. But this is a myth. Unless the dog is dying and it has a severe kidney disease, yes, we have to, because we need to make the animal to eat whatever he wants or she wants, because they just need quality of life. But other than that, if it's an initial stage or coming to moderate but not too high, we maintain the same level. Why? Because the protein is bioavailable. Okay, different from kibbles that the amino acids are all synthetic. In natural food, everything is bioavailable, so the kidney can process everything. Okay, so in this type of diet, we must have low in carbohydrates, high in humidity, and in natural diets, this is already happening. We can supplement the omega-3, we must include probiotics, and we must split the diet to 3 to 4 times a day in a smaller amount for the dog to process it and to accept the food easier. Same for cats. Okay. So here is a suggestion if the animal is in crisis or terminal in kidney disease. So the goal here is not balance the nutrients. The goal here is making the animal to have a quality of life and get away from the crisis. So the recommendation is 2/3 of the diet to be whole grain rice. Yes, it's high in carbohydrate, but as I said, the animal needs to get out of the crisis. Okay. Once the animal is out of the crisis, we come back to the normal diet, low in carbohydrate. This doesn't apply for cats, only for dogs. Um, white fish, duck, it's going to be 130 as a source of protein. When the animal starts to get out of the crisis and start to accept more kind of food, then we can add a little bit of vegetables and eggs. But if the animal doesn't tolerate that or doesn't accept that, then we continue to it until the animal starts accepting something else. For dogs, we normally use, once they get out of the crisis, a diet which has 14 to 20% of protein and a maximum of 0.5% of phosphorus. And for cats, 28 to 35% of protein and maximum of 0.6% of phosphorus. Any questions? Yes, Juliana?
Sorry, I forget the question.
Don't worry. Okay, so inflammatory bowel disease is another condition that it's often confused with, oh, the animal has a diarrhea because it's eating this, because of that. Okay, sometimes the animal always have this problem, and that can be because of bowel disease condition. Um, this condition is directly related to food intolerance and sensitivity that we talked about last week about allergy sensitivities. So usually when the animal is sensitive to an ingredient, to a food, the first symptom is diarrhea, gas, and other problems with the gastrointestinal system. So for this condition, the ideal diet is ingredients with high digestibility, which means a natural food, no gluten, hypoallergenic. You must make the test for sensitivity. No lactose, so milk kefir, for example, is not a type of probiotic I would include in this situation. Soluble fiber, prebiotics, probiotics, omega-3. We usually increase a little bit the amount of potassium and vitamin because this kind of animals, because of the disease, they are not absorbing the nutrients as much as they should do. So polyvitamin and mineral supplement is important even if they are in a raw diet until they get out of the crisis. When the bowel um, is not doesn't have the inflammation anymore, then we don't need those supplements anymore. Of course, we need the basic supplements for normal diet. And other supplements that we can include for, oh, I'm sorry, this is another disease. I was like, what? I'm tired. Any questions about inflammatory bowel disease?
Which potassium source do you recommend?
The eggshell pounder, it's a great source of potassium, so you can use that. You can also use, how can I say that? The shells from seashell. When you break it or you process it, it's a very great source of potassium.
Qué pena, compañeros, ¿alguno captó la idea de la profe? Porque no la entendí.
Entendí que se
Can you
pueden hacer
repeat
conchas,
the
conchas de almejas, pues, y... Ay, se me fue.
sorry, could you repeat the answer, please?
Eggshell, cáscara de huevos, and seashell.
Ah, las. ¿Cómo se llama esta
Como la
Cáscaras
palabra?
de
cáscara de
huevos
sardinas y la
y
cáscara de huevos.
¿Cómo se llama? Las almejas.
¿De huevo y cuál?
Cáscara de
las conchas. Creo
conchas.
que son más conchas.
Yes,
Porque yo le
conchas.
entiendo la
Conchas, yeah.
cáscara de huevo,
Yes.
le entiendo, pero conchas.
Conchas marinas y cáscara de huevo.
Cáscara
Yes.
o conchas, listo. Gracias.
Some seafood like crab, how can I say that in English? Camarão,
Shrimp, yeah.
shrimp. Yes, shrimp, They are rich in
Oysters,
potassium
maybe?
too.
Like
Oysters,
the
yes.
shell from the
Nuts in general, like peanuts, they are also rich in potassium.
In inflammatory disease, have you ever supplemented with vitamin B12? It's just that I've read some articles, but
Mhm.
I don't really understand how it works.
Not only the vitamin B12, because the meat that we use in the diet, and we use a lot of meat, is very rich in vitamin B12. But usually, when we use the blends of extra supplementation for the mix of vitamins and minerals supplements, they also have the B12.
Oh, okay, thank you.
No problem. Okay. Heart disease. Heart disease, same thing, semi-basal diet. Normally, the literature recommend supplementing these these nutrients here. So coenzyme Q10, they recommend a doses of 100 to 400 milligrams per day. If it's a cat or a small dog, it goes close to 100. If it's a mid-sized dog, 250-ish, depending on the size. If it's a very big dog, 400 grams per day. Okay. So this helps as an antioxidant, and it helps to the degenerative disorder of the heart. So when we're supplementing that, we decrease the speed of degeneration of the heart. L-carnitine as well, because it converts the fat in energy. So combined with taurina, it helps with the heart. So the doses recommended by the literature is 500 for cats and small dogs, and up to 1,500 milligrams per day for giant dogs. Magnesium. So usually we don't supplement the only the magnesium, but we try to find sources of magnesium. So the dark green leaves and the seeds, they are source of magnesium that you can use. Omega-3, taurine. For cats is an extra doses of taurine that we can increase 500 milligrams per day more. And for dogs, we are including supplementation with taurine, uh, depending on the size of the dog, from 500 to 1,500 milligrams per day. Vitamin D as well, we can either supplement only the vitamin D, or we can use more sources of vitamin D in food, like fish and eggs. Um, for you to know if the dog is deficient in vitamin D or doesn't get intoxicated in vitamin D, there is a blood test to do. I don't know in Colombia how it is, but here is very, very expensive to do this. So try to avoiding the intoxication in vitamin D. Is preferred to, instead of using the supplement, using natural sources. So that way you avoid intoxication. And vitamin E, doses 200 UI per day for cats and very small dogs, and up to 500 UI per day for big dogs. Medium dogs between. Questions? So I'll move to the next, which is liver disease. So liver disease is another very common disease, especially dogs that came from other conditions like tick disease. Um, I'm sorry, the name of the disease just came out of my brain. But some conditions that can lead to liver disease is very common, especially in dogs. So to support the liver, first of all, we need to eliminate the toxins that we can control. For example, cleaning products in the house, pesticides. So we opt for organic food, have metals, all unnecessary medication. We also need to control the weight of the animal. And also we add 100 to 200 milligrams twice per day of cardio mariano, which is a herb, uh, curcum, and spirulina because they help the liver to disintoxicate. As the liver is the organ that filters all the toxins, and we don't want them to risk to have pathogenic bacteria in the food. So in this case, we recommend cooked diet for these animals, even dogs or cats, just to avoid the liver that is not working. We have a secondary disease, so we try our best to avoid it by cooking the food. Let me see what else. I think, yes, that's basically what is it. Any questions? No? Yeah.
Cardo Mariano is the same silimarine?
Yeah. Mm-hmm.
If you have a dog that has cancer and also has liver disease, which diet do you like? Which one would be better? The
You can do a keto diet, but instead of raw, it needs to be cooked.
oh, okay.
Yeah. So instead of meat bones, as it needs to be cooked, you are substituting all to proteins, and you have to supplement with the minerals,
Oh,
especially
okay.
calcium. Yeah.
Are those like I don't know if you've seen that they put like chicken legs in the blender and bones get kind of like blended, some of them, and then they put the mixture through a strainer. Like, would that be a source of calcium since it has like some type of bone? Yeah.
Yes. Yes.
Okay.
They call it bone meal.
Oh, okay. But
Yeah.
when it's cooked, like, I don't know if you have seen it, it's kind of
No,
like a
it can't be
gelatin.
cooked. Oh, okay, okay. It looks like a bone broth.
Kind of, yeah. Yeah, it gets like
Yeah.
solidified with the.
Yeah. I don't know if that's the same thing I'm talking about, but for example, bone broth is not rich in calcium. Bone broth, it's very rich in all the other minerals. It can take from the bone lots of other minerals, but not the calcium. The calcium is very poor in the bone broth. So if you are supplementing with bone broth, we still need a source of calcium.
Okay, thank you.
No problem. Okay, we are almost out of time. So let me finish. I think I have two more diseases. So one is neurological diseases like epilepsy or convulsiones. That guys, I'm so tired that my English is not working very well normally at this time of the day. I'm so sorry. So in this type of disease, we avoid ingredients like all the ingredients that can promote inflammation. For example, soy, corn, or any other type of ingredients that the animal can be sensitive, which in this type of diseases we must do the sensitivity test as well, because the sensitivity of an ingredient or a nutrient can trigger the epilepsy. We also avoid the food that cause spikes of sugar in the blood. So again, the carbohydrates with high glycemic level. Uh, Food that has glutamato and aspartato. Um, Dry fruits, sunflower seeds, sunflower, pumpkin seeds, rabbit, and all these things here we need to avoid because usually they trigger the epilepsy crisis. So this all that we need to avoid in this situation. Also, sometimes the animal has those crises of epilepsy because they are deficient in vitamins and minerals for some reason. So another test that I recommend to do is a blood test to check for deficiency. We would supplement with omega-3, probiotics and prebiotics, gelatin, and they recommend 1.5 tablespoon to 3 tablespoons, depending on the size of the animal, twice a day, coconut oil, and silimarine. Any questions about here? It's the same
Yes.
thing. It's a basal diet. We just need to control those ingredients. Yes?
Alubia, soya, frutos secos, seeds, no use it?
No, no using. No.
No use it rabbit? No
Mm-mm,
turkey?
mm-mm. No, in this case, because they can trigger the epilepsy and yeah.
Oh my God.
Yes. So you're a little bit limited here.
What type of protein is better in these cases?
Maybe if the animal is not sensitive to it, I would say pork, beef, and chicken can be good.
I have another question. In other disease in cancer, do you say no is relationship with the drugs for control to fleas? What natural uh, control or what do you use for control the fleas or here for the tropic garrapatas?
Mhm.
What do you recommend?
I know that in Colombia it is hot and probably you have lots of fleas and ticks. Okay, so in this case, yes, you must use it because maybe a natural one cannot control. Here in Canada, we don't have so much, so the natural does control it. But I usually do a spray with calendula oil. I'm not gonna remember all of that, but I can put in the materials for you. It's a mix of oregano, calendula, and other herbs and spices that repel insects in general. So usually, for example, if I go for a walk with my dogs, before going for a walk, I spray them this blend. And after going for a walk, I brush them. So anything that is near them, I can try to eliminate. And if they go for a walk again, I have to spray it again. So if it's a dog that lives outside, probably that's not gonna work. So I know that in tropical countries, this is a challenge. So if you have to use those medications, you have to use those medications. It's better that, okay, I am eliminating all the other types of toxins, but like I'll keep one instead of having a very bad infestation or other disease with the cancer. So if you have to do, have to do.
Thanks.
No problem.
Please,
Juliana?
write the recipe of the
Yes,
repellent.
yes. I
Thank you.
can put in the materials for you. I have a couple blends that I like to use.
Thanks.
And Juliana?
Yes, white jelly is recommended.
Because the jelly, it helps to protect the neurons. Some studies they show that it might control the triggers, so that's why they recommend it.
Thank you.
No problem. Last disease. So thyroids are another disease, and is the last common disease that we might have that we can help with natural diet. Sorry, I'm all itchy. I'm so sorry. Okay, so most of the times, the animals they are misdiagnosticated for thyroid disease. As I told you when we were talking about, my goodness, my brain. When we were talking about the dogs that get old and they have problem behaviors and they get misdiagnosed as well. And when we see a test and, oh, that's the reason why the behavior is changing. Same thing here, it's the same thing actually. So 90% of the cases of animals that are putting down, sacrificated because of misbehaving, especially aggression, they might suffer from hypothyroidism. Okay, and 10% of them might suffer from hyperthyroidism. So here are the foods that avoid the production of the hormone of the thyroid. So these are the ones, and the ones that stimulates the hormones of thyroids. Okay, so if they have hypothyroidism, which means it's low, we use those nutrients here. So we enrich the diet with those nutrients. We can use supplements, or we can use food that are great sources of these nutrients. Usually when we change from keto to a natural diet that is well balanced, we are already helping the animal naturally. If you want that to get faster, we can supplement for a couple months. I usually say 2 months, 3 months maximum, and then they come back to normal. Usually when you do the test again, the levels come back to normal. Okay, and the opposite, if they have a hyperthyroidism, and then we are using those kind of ingredients, usually we don't recommend corn and soy because they are um, animals usually are high sensitive to those ingredients. So if the animal is sensitive to them, I'm not using, but if the animal is not sensitive to them, in this condition here, I can use it, okay? Because they inhibit the production of the hormone, so we can use that until the levels get normal, and then we go back to the normal diet. Any questions here?
Teacher, for seeing which source do you recommend? For example, for urine, the urine salt, but for seeing which supplement, natural supplement.
Sorry, say again?
The natural supplement of zinc, which one do you recommend?
Seeds.
Oh, seeds.
Seeds. Chia seeds, pumpkin seeds, seeds in general. They are very rich in zinc.
Okay.
Okay. Any other questions?
¿Cuál dijo que era? ¿Cuál dijo que era el más rico en zinc?
Semillas.
Las semillas de calabaza, de girasol,
Chia.
chía.
Ok, ok,
Semillas
gracias.
de cereales, perdón, no de cereales.
No, no cereales.
No, de oleaginosas.
Yes.
Sunflower, semillas of sunflower, of girasol.
Sí. Chia seeds. Flax seeds. Okay, just want to show you guys some diets here. Okay. This dog here, he had problems with urinary crystals. So in here, I want to show you the type of supplements that we were using as natural supplements. So turmeric, omega-3, this is a source of calcium, bone broth, herbs, sea kelp, and yes, but it's not what I wanted to show. Oh, this dog here she had a disease when she was a puppy, and as a consequence, her liver doesn't work very well. So she has a high ALT very often because of the disease that she had. So we always have to control it. She does exams every 6 months. So here is the supplements that we use to control it. So milk tyrstol, spirulina, turmeric, omega-3. The cranberry is because of the kidney. That she also have consequences with her kidney. A blend of reishi mushroom, chia, and bone broth. We do some teas too, as in order to disintoxicate her liver, and we do a detox once a month as well. So she goes with for 24 hours to 48 hours with no food, just with bone broth, and then we start food normally, gradually until we reach normal. One more, sake. Sake is diabetes, and diabetes I think I didn't mention here. For diabetes, we need to keep the level of sugar low as normal, diabetes. So in this case here, the animal didn't accepted the raw diet, and the dog also doesn't accept a high level protein diet. So if I want to do a cookie diet and I don't want to put any types of carbs for him, he doesn't eat. So the minimum of carbohydrates that I could use for him is 200 grams, where in these types of carbohydrates we are using quinoa because the level of carbohydrates is lower than rice or sweet potato or any other kind of carbohydrate. Yeah, so I made a menu for him, and he supplemented with a blend of my vitamins and mineral supplement. I want to highlight the cabbage because it's very common to use it because it's high in fiber and has some phytotherapics in there that helps to decrease the level of blood in the sugar in the blood. So we use that a lot. And I think that's it. Let me see if I have any other diet to show. No, I think that's it for now. Any questions? Any comments?
Teacher, I would like to ask you about copper.
Mm-hmm.
Which source do you use? For example,
Same thing. Mm-hmm.
same
Sorry?
for copper.
So for copper, I can use nuts like peanuts. I can use organs, especially the liver and the kidneys,
But
and shellfish.
but of cow, liver of cow or of
It
pig?
can be cow, it can be pig, or it can be chicken.
Okay.
Okay.
And for vitamin K,
Vitamin K.
yes.
Vitamin K, I can use green, dark green leaves. I can use even lettuce. I can do. Usually I will find in herbs, those that you plant. I just cannot have like onion and onion related type because it's toxic for dogs and cat, but usually I can find there.
Okay, teacher. Because I found that a good source of vitamin K
Mm-hmm.
could be the egg.
Yeah, egg can have. It doesn't have like a high amount, but depending on the amount of egg that you're using in the diet, that can supply.
And liver and cow liver as copper was a vitamin K source too, as copper
Yeah,
liver, well, for both.
yeah. That's why liver is one of the most important organs that we use in natural diet. And that's why we cannot use that very, very much, no more than 10%, because the concentration of some minerals and some vitamins in there is very high. So they are
Okay.
usually, yeah,
So the liver is maximum 10%. 10.
10% of the diet. Usually for animals that are very sensitive, I usually use 5% of liver and the other 5% in other organs.
Okay.
That can be kidney, that can be lungs, that can be brain, that can be other organs. But 5% at least liver because the concentration it's really, really high.
And despite liver, do you use kidney and
Kidney, lungs, brain, if you find it's hard to find,
okay. Kidneys are good.
spleen.
I read that kidney was a good supplement, but
It is.
but only 10 the 10%.
Hmm. All the secreted organs, you use a maximum of 10% because they have a very high concentration in minerals and vitamins.
Thank you. Thank you for all the question for today, teacher.
No problem. Okay, so for now, you are able to do your final evaluation. So, if you didn't get 5 points in the activity 4, I give the feedback to the person that submitted the assignment. Okay, so try to reach out to your group member to check the comments to see what was the mistake so you don't make the same mistake on your final evaluation. If you got 5 points, it means that everything was good, everything was perfect. If you didn't get 5, something there was missing. So for you to don't make the same mistake, just check my feedback so you can correct that and don't make the same mistake for the final evaluation, okay? And I think that's it for today. Next week, we are going to work on the software so that we can close our course. And yeah, that's it. Adriana, do you have a question? No questions?
Sorry, I take close the speaker.
Don't worry.
I want to take clear. We take two more activities, one in group, one individual. Yes.
Yes.
Okay. The group is for 2 of June
Yes.
and the final for 5 of June.
Yes.
Okay. Thank you.
Okay. I know it's a very tight timeline, but yeah, after the last class, I have, I think, only 3 days to grade all your work and post it. So that's why everything's in a rush now. All right. Thank you, everybody. Have a great night. And I see you next Wednesday for our last class. I recommend you to come prepare for a picture. I like to take a picture of everybody in the last day. So Come beautiful. Take some perfume too. Okay. Have a great night and see you next week. I have a question here. I will check if I can do that. I will let you know in the platform, okay? Because I have a very short deadline to grade everything. So I'll double check with Alex if he can extend for me. If he does, I can extend for you. All right. Have a great night. Thank you, everybody.
Have a good
Buenas
Teacher, thank
noches.
you.
Thank you, teacher.
Thank you.
Thanks. Buenas noches.
Bye bye. Buenas noches.